Hey there, pharmacy enthusiasts! Welcome back to our channel, where we dive deep into the world of pharmaceuticals. Today, we're going to explore a tragic, but fascinating story about how one commonly used drug nearly wiped out an entire species, and what that means for all of us. Intrigued? Let's get started. How a pharmacy drug almost destroyed India's vultures, the Diclofenac disaster. Introduction to vultures and their role. Vultures. These magnificent birds may not be everyone's favorite, but they play a critical role in our ecosystem. Acting as nature's cleanup crew, they feast on animal carcasses, preventing the spread of diseases and maintaining the balance of the environment. In India, vultures have been a keystone species for centuries, but something went terribly wrong. By the early 2000s, the vulture population in India had plummeted by over 95%. What happened? Well, the answer lies in a drug we often use in our day-to-day lives, Diclofenac. The rise and fall of vultures. Diclofenac is a non-steroidal anti-inflammatory drug and widely used to treat pain and inflammation in both humans and animals. In the 1990s, it became popular among livestock farmers in India for its effectiveness. But what they didn't know was that Diclofenac was deadly to vultures. So, how does a drug meant to help animals end up killing vultures? When cattle treated with Diclofenac die, their carcasses still contain traces of the drug. Vultures, being scavengers, consume these carcasses, and that's where the trouble begins. The toxic effect of Diclofenac on vultures. Diclofenac is incredibly toxic to vultures. Even small amounts can cause kidney failure, leading to death within just a few days. As the use of Diclofenac spread, so did the number of vulture deaths. Before long, 3 species of vultures in India, the slender-billed, white-backed, and long-billed vultures, were on the brink of extinction. Imagine losing 95% of a species in just a few years. It's one of the fastest declines of a bird species in recorded history. But the story doesn't end there. The vulture crisis had a domino effect, leading to serious consequences for human health. The ripple effect on human health. With fewer vultures around, carcasses were left to rot, attracting other scavengers like feral dogs and rats. These animals aren't just unpleasant, they're also vectors for diseases. Rabies, anthrax, and other zoonotic infections started to spread more easily, leading to an increase in human mortality rates. A study showed that in areas where vultures had disappeared, human death rates rose by at least 4.7%. That's a staggering number, all linked to the absence of these vital birds. The fight for conservation and what's next. The Indian government eventually recognized the crisis and banned the veterinary use of Diclofenac in 2006. But enforcing the ban has been a challenge. Diclofenac intended for human use has still found its way into veterinary practices, and similar drugs like aceclofenac, which are also harmful to vultures, remain. The good news? Conservation efforts are underway to protect the remaining vulture populations and find safer alternatives to Diclofenac. But this tragedy serves as a powerful reminder of how interconnected our ecosystems are, and how one small change, like the introduction of a drug, can have far-reaching consequences. Conclusion and call to action. So, what can we do? As pharmacists, researchers, and informed citizens, it's crucial that we understand the broader impacts of the drugs we develop and use. Whether it's advocating for safer alternatives or supporting conservation efforts, every action counts. Thanks for watching. If you found this video informative, give it a thumbs up, share it with your friends, and don't forget to subscribe for more content like this. Let's work together to make the world a healthier, safer place, both for us and for the amazing creatures we share it with. See you in the next video.